Good afternoon, everybody, and welcome to the Doctor's Corner. Of course, the doctor here is Dr. Mark Pinsky. Doc, how you doing?
Always good to see you, buddy.
Doc, you got a great show today. You've got 4 patients for Pinsky weight loss that you're going to talk to who, over a 6-month period, 146 pounds.
Yeah, it's pretty impressive what they've been able to do. And what you're going to find out and what you're going to hear about is every one of their journeys is different. Some of their medical conditions seem just overbearing and something that they just could never overcome, but they have. And because they're of their own intestinal fortitude, the support of Pinsky Weight Loss, the clinic, the program itself, the ease of use, they're going to talk about all of that, and it's going to prove that you don't have to be perfect to achieve fat loss.
As they get started to watch this, Doc, what's the one thing you want the viewers to get out of this?
I want them to get out of it that it doesn't matter whether you're young, whether you're old, whether you're really super heavy, if you just need to lose 5 or 10 pounds. You have to commit yourself to a total lifestyle change. And if you're going to do that, you still don't have to be perfect to do it.
Right.
Right?
No.
You can live your life, cheat a little bit along the way, but understand that if you're going to cheat, you somehow have to get back on the wagon, and you somehow have to incorporate activity in that pattern. Now, how you do that, we work with you to figure out what's the best way for you to do that.
All right, here we go. Here's a look at some of those great interviews with Dr. Pinsky and some of his patients of Pinsky Weight Loss Clinic.
I'd like to welcome Steve Alm to the show. Steve, welcome to our production of Space Coast Daily TV and the Doctor's Corner.
Thank you.
All right. So Steve is a patient of mine who has been in the weight loss program for how long?
6 months.
6 months now. So Steve is one of the original people that started Pinsky Weight Loss in conjunction with Your Better Self. And as we've talked about, the program is really designed to be fairly simple to do. And Steve has been with me since the very beginning, so he's dealt with a lot of the quirks since we've got some of the bugs worked out. And really the reason I brought Steve on is because Steve has overcome a lot of medical issues. What I want to talk about is what those medical issues are first, and then how he was able to even lose weight despite those medical issues, which I think is very critical. So, Steve, let's talk a little bit about some of the medical stuff.
Okay.
Last year or the year before, you were diagnosed with prostate cancer, right?
Yes.
Okay. And so throughout the treatment of that prostate cancer, we had to lower his testosterone. And if anybody knows out there, just you ladies, if you don't have your hormones, men, if you don't have your hormones, you just feel terrible and tired all the time. And so that's where Steve, really suffers a lot, because in order to lose weight, you normally need to have your hormones balanced, because it's hard to achieve fat loss. And that was the big thing. I was really nervous about that when Steve came, and we talked about that. The second is Steve is also a diabetic, not on insulin, but is a type 2 dependent diabetic. He also has a history of coronary disease, has a history of what we call hypertensive heart disease, so he's on a lot of different medications, has a history of sleep apnea, but that was before his 45-pound weight loss. And now we're being tested to see if he still has sleep apnea. I'm willing to bet he does not. And his sleep has been a big issue. And one of the things we talk about in the program is the importance of sleep in losing weight. We talked about this before. Why? Because sleep, if you don't, you release a substance called ghrelin. And if you have ghrelin, it makes you crave, and it increases your hunger. And when you sleep, you increase leptin levels, which suppresses that hunger. So Steve can't do that, and that's really been a huge issue. Steve's emphatic about not taking medications for his weight loss, so we have done none of that. We've done no medications for his weight loss.
Correct.
So what Steve has done, all on his own, is he said, I'm going to be held accountable for all this, and I'm actually going to log everything I do. And he brings that log to me every week, and he pays the price for that log because, unfortunately, he cheats. And so when he cheats, and believe me, his cheating now is nothing like his cheating was before. It's very minimal in nature by comparison to what it was before,
Yeah.
right?
Yes.
Okay. So, one other thing, do you exercise?
Very little.
Right, and the reason is because he's so tired all the time, he really can't exercise. So, that's what we're going to talk about today. We're going to talk a little bit about the latest things that have happened. How many pounds of weight? 45, right?
45, 46, in that range.
Right.
Yeah.
Again, done over the last 6 months, so again, been a very slow process, but his process is slower because of all his medical conditions, but not impossible to do. So, he's a brave guy. He comes on here to talk about all of his issues, and I'm here to tell you that the fact that he's done 45 pounds is just an amazing feat for him, and it's really his own intestinal fortitude that has allowed him to do it. Let's talk a little bit about the program, right?
Okay.
You've done other programs before, correct?
Yes, twice.
Okay, so he did my first program with me. He lost a significant amount of weight on that program, kind of fell off the wagon. The difference between that program and this program in your mind?
I think this one's a lot better because we have the weekly get-together where I am held accountable. There's more structure to it, and that's something that I needed as far as a program. And it's also providing positive encouragement every week. It's not negative, it's positive. Hey, you were good this day, you fell off a little bit this day, here's some recommendations for improvement, and that's been extremely helpful.
Awesome. And so I try I try to be encouraging. Some of you may find that hard to believe, but I do try to be encouraging. And one of the things I'm so proud of Steve for is he never gives up, right? He's just that guy who just won't give up in spite of everything he's been through. And I think that's a lesson for everybody to learn. No matter how old you are, how young you are, it doesn't really matter. Now, one of the things that takes a little bit, maybe to get used to, I don't know, I'm going to ask you that question because I haven't asked anybody. Are the shakes hard to get used to? Because we base a lot of it on shakes.
No, I think there are 3 different flavors, and that depends on the individual.
Right.
That I found that I preferred the chocolate over the vanilla or the strawberry. Someone else may have a preference for one of the other flavors.
Right.
But I like the chocolate.
Okay. And so not an issue there for you, right?
No.
Right. And Steve, roughly how many shakes you do in a day? Like 3, right?
2 to 3.
Right. And so we try to encourage him to do 3 because it usually with eating every 3 to 4 hours, if he does that, he's less likely to snack and he's less likely to do things that he's not, that we don't want him to do per se. What else about the program can you tell us that you particularly like? I like the fact that you gleaned the fact that we've gained structure to the program. That certainly was intentionally done.
I think also the fact that you're recording everything that you eat, it lets you know, hey, I'm consuming this, and it might be too much or too little, the right material, the wrong material, and it gives you a good baseline to work with.
Right. So again, Steve has taken that upon himself. We don't necessarily make people do that. If you need to do that, we like people to do that, but they don't have to do that. He has found it very helpful. Other people might find that too cumbersome to do, and they may not want to do that. One of the other things we've done, which I wanted to prove to Steve, was that it's not really about weight. Really, it's about fat, right? It's fat that causes disease. And one of the things we're working on with Steve is to really lower his body fat. And he's really done a tremendous job doing that. Now, the latest and greatest is we send him back to the sleep doctor. We actually sent him to a different sleep doctor. And that sleep doctor, because I went to Steve and I said, listen, I got to get you to sleep somehow, some way. So describe how you were sleeping for them, because I think they need to hear that.
Well, basically, I had a BiPAP machine, which is like a CPAP, and I start out in a recliner. I'd be in there, and I'd wake up about every hour and a half, and I'd end up switching between a recliner and go to bed for an hour and a half to 2 hours, come back to the recliner, put the machine back on, and it just wasn't a good program. Wasn't seeing any real benefit from it.
Right. So now what we're doing is we're retesting him to see if the 45-pound weight loss has done anything. I'm willing to bet you it has. I'm willing to bet you that if he has sleep apnea, it's very mild now, and that the machine is actually causing him more problems than helping him. I think the machine is actually what's waking him up and causing the problem. So we're going to try to take away the machine, redirect his sleep hygiene, which is a huge thing for almost everybody out there, structure him in a way where he can get to sleep a little bit better, create habits for him before he goes to bed and actually lays down. And we're going to find those results, and then we'll keep you posted on those results, because I think that will help a lot of people out there who really have been told they have sleep apnea, who think they have sleep apnea. And maybe now I've lost a ton of weight and really don't need the CPAP machine or BiPAP machine anymore. All right, so what else can you tell us that you think would be helpful to those people out there who are struggling and trying to lose some weight?
Don't give up. Little achievements toward a greater goal are the best things. You're going to go up, you're going to go down. Some people will show, like I did, a significant weight loss, and then you tend to plateau. And then you have to refocus to get past that plateau and continue toward your ultimate goal.
I love it. All right, Steve, thank you so much for being with us. We appreciate those words of inspiration and wisdom and based on practicality. And we'll keep everybody posted on your progress.
Sounds good, Doc.
Take care.
Thank you. See you next week.
I'd like to thank Steve Alm for coming on and sharing his story with us. I think you'll find that his journey has been a courageous one and that he's an inspiration to all of us who've battled weight, who felt that they were fighting insurmountable odds. And we're going to let you follow Steve's journey here over the next several weeks. But again, thanks, Steve, so much for making this a wonderful show. And you've been watching The Doctor's Corner on Space Coast Daily TV. I'm your host, Dr. Mark Pinsky.